guys! Welcome back. We're Sportans, and for this week's video, we're introducing to you a new series called What If?
What if tumama ka sa chair ng malakas at tatamaan yung arm mo? This injury is what you call a bruise. It is a common skin injury that appears as a discoloration and happens when a damaged blood cell gathers near the surface of the skin. You will know that you have a bruise when there's a reddish spot on the skin that will turn blue or dark purple after a few hours. That spot is usually tender and painful. People usually get this when bumping into hard objects, excessive exercise, bleeding disorder, when skin becomes thinner with age, and when taking medication to thin blood. Gusto mo bang gamutin to? First, wrap a towel around an ice and cold compress the area for 20 to 30 minutes. If there is a large bruise on the leg, elevate it for 24 hours. Take acetaminophen for pain and avoid aspirin or other medications that slow the blood from clotting, for it will prolong the bleeding. After 48 hours, apply hot compress for 10 minutes to increase blood flow. And lastly, seek the doctor if the bruise does not improve within 2 weeks and does not fade within 3 to 4 weeks.
Napaso ka? Masyado bang mainit yung hinahawakan mo? Burns occur when your skin tissues get damaged because of heat, sunlight, and electricity. Scald naman if due to liquid. If left untreated, it may result in infections. This often happens when cooking, such as handling hot pans or cooking with hot liquids. Ang pinaka-common na symptoms ng burns at scalds ay ang pananakit, pamamaga at pamamalat sa apektadong parte ng katawan. Paalala na hindi advisable tanggalin ang balat kapag ito ay dulot ng scalds. Pero huwag kakabahan, kaibigan. Minor burns and scalds can be treated by running cold water over it. No ice. Pwede rin ang aloe vera para sa sunburn at antibiotic cream sa iba pang burn. Kapag sa scalds naman, matapos basain, takpan ito ng moist bandage hanggang sa madala sa ospital. Para naman sa moderate and severe burns and scalds, maaaring kailanganin ng professional medical attention.
While you are walking on an uneven surface, you suddenly twist your ankle. The injury that may happen is called a sprain. It is the stretching or tearing of ligaments that connect the two bones in your joints, and it occurs on the ankle or knee. You will know that you have a sprain when there is pain, swelling, and bruising on the joint, or the limited ability to move. And lastly, when you hear a pop sound on where the joint is. The causes of sprain are falling awkwardly from a jump while playing sports, walking on uneven ground, and experiencing trauma on the joint. Gusto mo ba gumaling ito? You will need to do the RICE method, and this is for partial or mild tears. First, rest the injury for 48 hours. Second, ice it for 20 minutes at a time, 48 times a day. Third, compress to help reduce the swelling. And lastly, elevate the limb 6 to 10 inches above the heart level. For complete tear of the ligaments, you will need to seek help from medical professionals.
Fun fact!
Fun fact! Mount Everest is the highest mountain in the world, which is why many mountaineers go there for an expedition. Last May 11, 1996, there was an infamous disaster that killed over 8 people due to a blizzard. The annual number of deaths in Mount Everest is around 300. Pupunta ka pa ba doon?
What if habang nagja-jogging ka ay namali ang pagtapak mo? Itong injury na ito ay tinatawag na strain. A strain is an injury to a tendon or muscle that has been stretched or torn due to overuse, which may cause swelling, bruising, or occasionally you may feel and hear a pop in the joint. This injury can happen when you landed awkwardly from a jump or walking on uneven surfaces. Gusto mo bang gamutin ito? Maaari mo itong gamutin gamit ang RICE method. R means to rest. You must rest or not use the injured area for about 48 hours. Ice naman for I. Apply cold compress in the place of injury for 20 minutes at a time for 48 times a day. C is for compression or wrapping the injury with some cloth to reduce the swelling. And lastly, E for elevation. Elevate the injured area or sore area on pillows while applying ice and anytime you are sitting or lying down.
What if? What if naglalakad ka nang bigla kang natisod at napangtukod mo ang iyong mga daliri? This may cause dislocation, which is an injury that occurs when a bone slips out of a joint, causing it to be out of position. It might occur because of a fall or a blow, playing contact sports, being hit by something, or the weakness of the muscles and tendons around the joint. Malalaman mo kung na-dislocate ang joint mo kung nakikita mo na na-deformed ito, or you may experience difficulty in moving the injured part. Symptoms may also include pain, bruising, numbness, swelling, or discoloration. Gusto mo bang gamutin ito? For the treatment, syempre ang una natin gagawin ay i-rest yung dislocated joint. Try to minimize the movement to avoid further complications. On the first 2 days, apply cold compress to relieve the swelling and pain. Kapag nabawasan na ito, pwede na tayo mag-apply ng hot compress to relax the tightened muscles. Take pain medicines such as acetaminophen, ibuprofen, or naproxen. Of course, consult a doctor for medical assistance kasi minsan kapag severe talaga yung nangyari, kinakailangan ng surgery. Lastly, during the recovery process, do some gentle exercises as instructed by your doctor or physical therapist to prevent the joint from locking up or freezing.
Fun fact!
Did you know that Mount Matterhorn in the Alps is dangerous because of its popularity? It is a popular peak in Switzerland, and the climb is not necessarily difficult nor technical, but the mountain has a rather high injury rate. This is due to the sheer amount of people climbing up and down the mountain. The tourists higher up the mountain dislodge stones which cascade down to the tourists lower down the route.
What if? What if habang naglalakad ka ay may natapakan kang madulas na bagay at namali ang hulog mo? Maaari kang magkaroon ng fracture. A fracture happens when the bone is broken or shattered. This can happen when a person is involved in car accidents, falls, or sports injuries. When you have a fracture, you may experience sudden pain, trouble using or moving the injured area, unable to bear weight, swelling, obvious deformity, warmth, bruising, or redness. Gusto mo bang gamutin ito? First, it is advisable to immediately go to the hospital for immediate care. But there are some first aids you can do to ease the pain. You can create a makeshift sling using a piece of clean cloth. There are a lot of tutorials you may find online that is easy enough to follow. Second, you may also apply ice to the site of the fracture and keep the patient always lying down and still as possible.
What if nagupit mo accidentally ang finger mo, or nadapa ka at nagasgas ang kamay mo, or di kaya natusok ka sa stapler? These injuries are what you call cuts, scrapes, and punctures. Cuts are also called lacerations, which is the tearing of the skin that results in an irregular wound. One can usually acquire them by using objects such as scissors and knives. Scrapes are also called abrasion, wherein the first layer of the skin is rubbed or scraped off. One usually gets this when they come into contact with rough surfaces. Punctures are deep wounds that are usually caused by pointed objects that pierces the skin. You can identify these wounds if you're experiencing mild to severe pain, bruising, bleeding, swelling, and skin discoloration. To treat these wounds, you will need to clean them with soap and water, apply antibiotic cream, then secure it with a sterile bandage. If there is bleeding, apply direct pressure using a clean cloth. If the wound is on your arm or leg, elevate the limb to slow down the bleeding. You will need to call for emergency assistance if there is suspected internal bleeding, abdominal and/or chest wounds, blood spurting out of the wound.
Fun fact!
Standing tall at 3,776 meters, did you know that Mount Fuji is the most climbed mountain in the world? It welcomes nearly 300,000 climbers on its slope each year. However, the vast majority of over 200,000 people who go up do not wear helmets. Guys naman, kaya na-aksidente. Be responsible, please.
What if, after a long day of walking, may naramdaman kang sakit at swelling sa likod ng ankles mo? This injury is what you call a blister. It is a common skin injury that causes painful swelling on the skin that contains liquid trapped between or beneath the top layer of the skin. This is caused by a lot of friction, usually on the back of the ankles because of the friction of wearing shoes. A blister appears either as a reddish spot on the affected area or as a swelling on the top layer of the skin. Gusto mo bang gamutin to? For minimal blisters like this, clean the area and reduce friction on the affected skin. When the blister forms into a closed blister with a roof still intact, leave the blister to heal and do not tear off the skin. When it becomes an open blister with a small tear, clean and apply antibiotic to the affected area and cover the blister with a band-aid. Lastly, when it becomes an open blister where the skin has been completely torn off, remove the excess torn tissue and do the same procedure as before.
What if you live in a warm tropical country like the Philippines? Here, we can see Choi. Choi. Hey, are you still with us? Choi. Oh no! Choi seemed to have suffered from hyperthermia. Also known as overheating, hyperthermia is a condition where an individual's body temperature is elevated beyond normal. This can be caused by dehydration, age-related changes to skin such as impaired blood circulation and inefficient sweat glands, heart, lung and kidney diseases, and even high blood pressure. Hyperthermia has 3 types or stages. The first stage is heat fatigue or cramps. A person with heat fatigue or cramps will experience excessive sweating, flushed or red skin, muscle spasms or cramps, headaches or lightheadedness, and nausea. The second stage is heat exhaustion. A person with heat exhaustion will experience cold, pale skin, extreme sweating, fast but weak pulse, nausea, vomiting, headache, muscle cramps, weakness, and even intense thirst. The third and last stage is heat stroke. A person that has a heat stroke will experience either a fast, strong pulse or a very weak pulse, fast, deep breathing, hot, red and wet skin, nausea, headache, dizziness, disorientation, blurred vision, lack of coordination, and fainting or losing of consciousness. You can treat hyperthermia by number 1, moving the person to a cool, shaded, and well-ventilated area. Lay them down and loosen or remove excess clothing. Number 2, call 119 and seek medical attention. Number 3, avoid letting the person eat or drink anything unless they are fully conscious. Number 4, if at the comfort of your home, have them take a cool shower or bath. Otherwise, use cool, wet clothes to cool down the skin. And lastly, it is important to have this person checked by a registered EMT or an ER doctor, for they might need IV fluids containing electrolytes to rehydrate. They must be closely monitored until symptoms resolve their body and their temperature returns to a safe level. What if you recreated that Tom and Jerry scene and made your living room into an ice rink? Well, Choi here tried it and I don't think it went very well. Based on Choi's symptoms, this may be a case of hypothermia. Hypothermia is a medical emergency that occurs when your body loses heat faster than it can produce heat, causing a dangerously low body temperature. This can be caused by prolonged exposures to very cold temperatures. And when you're exposed to cold temperatures, your body begins to lose heat faster than it can produce. Lengthy exposures will eventually use up all your body's stored energy, which leads to lower body temperature. So what exactly are the signs and symptoms of hypothermia? The signs and symptoms are shivering, exhaustion, confusion, fumbling hands, memory loss, slurred speech, and drowsiness.
Here are the things that you can do to help treat somebody with hypothermia. Number 1, move the person out of the cold. Move the person to a warm, dry location. However, if you are unable to move the person out of the cold, shield him or her from the cold and wind as much as possible. Keep him or her as well in a horizontal position.
Remove wet clothing. If the person is wearing wet clothing, remove it. Cut away clothing if necessary to avoid excessive movement.
Number 3, cover the person with blankets. Use layers of dry blankets or coats to warm the person. Cover the person's head and leaving only the face exposed. Number 4, monitor breathing. Number 5, provide warm beverages. And number 6, use warm, dry compresses and don't apply direct heat.
That is all for today for What If? Please like, subscribe, and follow us for more updates. Thanks for watching and see you next time.